To control coronavirus, testing and tracing must become a new way of life.
This is what the system should be doing, but new figures out today show it's not doing as well as it was before, with tracers in England reaching out to just over 72% of close contacts of someone who has COVID-19. That's down from over 76% the week before. And when Track and Trace was first set up, that number was just over 90%. But the Prime Minister still insists that the system is outperforming other countries.
It certainly does fit that description as well, beating, because I think I'm right in saying that we are now testing more per head of population than virtually any other country in Europe, certainly.
But there have been warnings from some scientists and local government officials who say the national setup is not fit for purpose. We've spoken to some of the councils facing the highest rates of COVID in England. These three say they've already set up their own track and trace, and this group are considering it. Serco is one of several companies that runs contact tracing. They've hired 10,000 staff to do so, but their callers on average reach out to just 2 people a day, and they've been criticised for not contacting enough people.
We are all working together on this. If the local councils aren't working alone, we are covering some of the areas that the local councils are working as well. The government had to start somewhere in terms of setting up a system. And actually, we probably got more people sitting there ready to do calls than we probably need at the moment.
So 10,000 who are speaking to an average of 2.4 people each. Again, I'm asking, is that value for money? Should we be putting our resources elsewhere?
So are the Nightingale hospitals that are currently empty, are they value for money? Are the 15,000 ventilators that are sitting there unused, are they value for money? You have to start somewhere. You have to go and build some capacity. Don't criticise the government for starting somewhere.
The National Test and Trace system still doesn't have an app. But one scientist who made one, which has over 3 million subscribers, says it's been a vital tool to show where new outbreaks are.
At the moment, we're seeing exactly the same places that are being highlighted in the press, with a few new ones. We're seeing slightly worrying Luton climbing up the rankings, which is close to London, which would be a real problem if London ended up problems, because that's been pretty good up to now.
But one scientist told me that the public are partly to blame.
The key point is these people have organised to get a test done. They have to provide contact details to get past the testing system, like a mobile phone number, so we can give them results. They should know that they're positive and they can expect a phone call, yet they don't answer the phone. The whole system of contact tracing relies on the system of involvement to the public.
With infection rates going up and tracing seemingly going down, it's a worrying combination. These trends need to be reversed to reduce the likelihood of more local lockdowns in the near future.
Well, earlier I spoke to Anthony Costello, a former director of the World Health Organization. I began by asking him whether the track and trace system in England was on the course to be world-beating, as the government had promised.
Well, it's a little depressing that 6 months into this, I'm still having to come on and talk about the limitations of find, test, trace, and isolate and support. I mean, we have a problem with finding cases, actually, and we need a much better health education strategy to make sure that we're getting people. The estimates are only about 40 to 70% of estimated cases get tested. And I think that if we move it to primary care now, that will be much more rapid and reliable. If you look at the home tests, only about 70% of them get a result back in 48 hours, which is very slow. China managed a much faster time from symptoms to getting a test result. They got it down to 3 days.
How worried are you about schools reopening in September and what effect that could have on the infection rate?
Well, I am worried in the sense that a lot of studies now, and in fact, Neil Ferguson has just come out with an estimate that schools reopening will push the R value up. Having said that, it's a national priority. I mean, it's a total scandal that our children have been out of education, particularly in the state sector, for the last 6 months. And it's absolutely vital that they get back into a routine. Otherwise, we're going to have almost a lost generation. And there are different views about what, the risks are of a second wave. Certainly, you would need to think about shielding multi-generational households and older people, because most children are not going to get the effects. Most will be asymptomatic or have a very mild illness.
In France, the R number has gone up quite dramatically, almost as high as the Spanish number. Do you think that France should now be on that list of countries to quarantine from?
Certainly, we need to strengthen border controls, and we need, to think about how we screen at airports, which is extremely important, or at any border check. Testing may be needed to be certified before you go or to come back. Whether we need to ban other countries that have roughly the same cases per 100 million, I'm not so sure.
Do you think the air bridges or the dismantling of certain air bridges in Europe is sensible at all, considering the fact that actually their infection rates, even if they're rising, are not nearly as high as the United States or Brazil, for instance?
I've been very critical of the government over the last few months. At the same time, the balance of getting the economy going again, and we are a trading nation, is extremely important, because we're now looking at increasing economic risks, and the Bank of England has put out considerable concerns in the last 2 days about this not being a V-shaped recovery.
How should the politicians in government approach this very delicate balance between, health, wealth, and indeed diplomacy?
That's the $64 billion question. I think they need to follow the evidence. I think they need to look at the costs and benefits of different approaches. But ultimately, if we don't aim for a zero COVID policy, one which reduces community transmission to zero in the UK and keeps it to a minimum with good quarantine procedures at airports and borders, then we'll end up with a worse economic situation because people won't have confidence.
As far as you're concerned, from the evidence in England, we are a long way from pursuing a zero COVID policy?
We're not a million miles away. And if we tightened up our find, test, trace, isolate and support, and we get down to Scottish levels, then we'll be able to negotiate much more diplomatically and perhaps aggressively with some of our European partners.
Anthony Costello, thank you very much indeed.
Thanks, Matt.
Now, they were bought to protect people on the front line, but 50 million face masks purchased by the government in England as part of a £252 million contract will not be used in the NHS due to safety concerns. Our reporter Aisha Tull joins us again with the details. Aisha.
Yes, well, Ianta Capital were the firm that were responsible for this, were responsible for these masks. And the main problem was that it had ear loops instead of head loops. Now, in the NHS, when you're dealing with close contact COVID patients, you need the right specifications. So the government have said that these aren't going to be used, but two organisations have bought a judicial review. They want to know why so much money was spent on the wrong ones. And Labour are also calling for an inquiry.
For months, we were told that the government was purchasing the right equipment for the front line. Yet again, it hasn't happened. And there needs now, I think, to be an investigation, an inquiry into what went wrong with this particular contract, because it's just not good enough to people who need that protective equipment that we find ourselves in this position.
We also spoke to the British Medical Association, who told us that this isn't the first time that protective equipment and the wrong protective equipment has been brought to their attention. Now, they're a trade union that looks after lots of NHS doctors, and they want everything to be OK for the winter months. And they really want this to be looked at to make sure that NHS staff are protective and we don't go back to the early days where we had problems with protective equipment.